I'd like to welcome you to our roundtable discussion, Executive Strategies for Successful Integration of Healthcare Data and Security Systems.
The four really hot topics right now, they're revolving around patient safety, the patient experience, as well as operational excellence, and all of those things and how they affect patient throughput. So as consumers start to take control of their healthcare choices and they start to pick the hospitals that they go to, they're going to want to make sure they're going to a place that is enjoyable for themselves and their family. Patient safety obviously plays a huge part in that, but then how do we also make that stay more enjoyable? You know, infrastructure optimization is absolutely the key to meeting the evolving needs of healthcare institutions right now moving forward.
You have to be able to integrate into the existing infrastructure. If you don't, you have to add, disparate functionality on top of disparate functionality, and there's no interoperability.
That's a huge challenge. We've got so many proprietary solutions in this environment, and trying to get those solutions to exchange information so we can be much more efficient in the delivery of healthcare, the management of healthcare, is going to be extremely difficult to do. In healthcare, the difficult part of this industry is there's no silver bullet. You've seen one hospital, you've seen one hospital.
Let's face it, the fact is the industry is going to have to go through a change. It's got to find people that it can trust.
Do you have the capital? Do you have the staff to actually go out and create the kinds of solutions that they're going to need to solve these many problems that we see in the hospitals? Yes, the responsibility for the applications and their production, their output, and how well they're used is on the business unit or the clinicians. But they have to be able to do that within a framework of an IT architecture infrastructure that's consistent.
If there's any feedback from a negative perspective on that particular process, it doesn't become IT's problem, it's the clinical leader's issues to address. I like to look at it as a football field, whereas IT is the referee, because if nobody's using it, it's not going to be successful.
If you're going to go out there, the vendor community definitely has to say, look, what's your roadmap? How far are you going to go? What do you really need? And here's the value.
Some of the larger health systems do $5–6 billion a year in revenue. So there are a lot of executives across the board that are gold on certain key performance indicators and need access to data to make real-time decisions on how to operate that particular hospital.
If you're in a pay-for-performance type of environment, the hospitals that have the ability to integrate this data and use it more effectively are going to be way ahead of the curve as these types of programs continue to roll out, and they will.
These are all solutions that are available today, right? But they're actually going to actually make changes, that are benefiting the bottom line. If you deploy it correctly, we've seen many organizations in numerous different industries use it very effectively, and actually it's far more secure than any of the other solutions that we've seen.
And if you've got an information problem inside of that hospital in terms of leakage, they'll just start referring their patients to a different hospital.